integral. This one is important because this is one that really will that I would suggest you all look to when it comes to singing and chanting, that I'm sure that we'll get into here pretty soon. But bottom line, in orange tier, here you are. You have to have a worker testing program, which is but if your workers are actually vaccinated, don't have to worry about that. Typically, these events are focused on tickets, advanced purchase only, pre-designated eating areas, also, kind of assigned seating as well, maintaining 6 feet of separation. I will talk to later that if you can have fully vaccinated sections, and we'll get into that a little bit later, and that would actually help you max the amount of physical distancing that you'll have inside your sanctuary. You can also see if you have a suite or something else. Not probably the case for most of our sanctuaries, but you can have even 25% occupancy in there. Next slide. Here's your gathering guidance. This was the third document that came out the same day to add more confusion. These are really defined, as you see there, with social or informal situations, and that's kind of important. They don't require a guest list. That's the big difference between something like this and a private event or an indoor seated event. There's no, guest list, things of that nature. Your outdoor maximum is 50. Your indoor is 25% the capacity, or 25 people, whichever is fewer. Next slide. And this was the final of the four guidance documents that was put out. It very closely mirrors what the CDC's interim guidance was for fully vaccinated. It really lays out, here's what you can do. You could spend time with others that are fully vaccinated indoors. You can do it without your face covering and without physical distancing. And then it even goes into what you can do with unvaccinated folks. And then it will also tell you, though, that it recommends that when you're outside in a more populous type setting, that you should continue to take the precautions to wear your mask, physically distance. And I'll take this opportunity to remind everybody that this is where I have a lot of people have a lot of problems getting their head around this, is that, hey, this guidance says that if I'm fully vaccinated, I pretty much can go without my face covering. Why do I have to wear a face covering if I'm fully vaccinated? I think the one reason, the best reason that I can give you is that we're on a seam. Right now, the county, the state, even the nation, we're not where we need to be with being, at 75% of those eligible fully vaccinated. And so what you have is you have a great deal of the public that is still waiting to get vaccinated, hasn't taken the opportunity. And so trying to differentiate who is and who isn't without showing our card everywhere we go, the default is that we assume that we're in an environment, a setting where not everybody is vaccinated. And as a result of that, the CDPH is indicating, as a result, we need to be with our face coverings on. I'll give you an example. Petco Park, you can have a fully vaccinated section. I won't go into details of how you get there, but within that fully vaccinated section, even though I can be shoulder to shoulder with Elizabeth Bustos, she and I will still be wearing masks, even though that we're outdoors and we're in a fully vaccinated section. The reason is the entire stadium is full of about 10,000 people, and it's just a big area, a lot of people moving around. And so what they're indicating is to be able to differentiate who's vaccinated, who's not, some with masks, some not. It would be what I call a dog's breakfast, really, really hard to do. And so that's why, even in a setting like that, they're going to tell fully vaccinated folks, keep your face coverings on. And that would be the same thing if, in fact, you want to establish a fully vaccinated section within your sanctuary so that you can get more space to bring in more folks. And we'll talk about that in a minute. But the same thing would apply. You can go shoulder to shoulder, but everybody in that fully vaccinated section inside the sanctuary still needs to wear their face coverings. Next slide. And so here's, we just pulled this out. This is a kind of a repeat from last week that we're at 50%. I know there's going to be questions, though, out there saying, hey, wait a second. Supreme Court just made a decision saying that the capacity limits, there is none for places of worship. And you're right. And I think there's a question coming that says, is the physical distancing still required? And the answer to that from CDPH, from state legal counsel, is yes. The 6-foot physical distance requirement is still in effect. And so that will, regardless of what the Supreme Court has said, which sounds unusual, you still have to maintain 6 feet of separation, indoor your sanctuary, between members that are not of the same household, unless, like I just said, you establish a particular vaccination section. Next slide. Okay, here's your tested and fully vaccinated individuals section. This is kind of what I was getting at. And this is the, I think that link up there is a hot link, but it's the addendum to the blueprint activity and business tiers table. It's probably one of the best documents that I keep with me. It just got updated on the 19th of April. So no more than I think, what, a day or two ago, 2 days ago. And this is what I mean by the vaccinated only section. And this is why it can pertain to your sanctuary. You're allowed to go up to, max capacity. You're still, though, supposed to maintain that 6 feet of separation. And so how do you get max capacity inside? One of the techniques that you can use is to establish a vaccination only section. This kind of tells you how you do that. If you look to this addendum, it will actually walk you through on what you need to do this. And so I'll give you another example. There's also a tested only section, very, very similar, but they cannot be in the same section, vaccinated and tested. They have to be separate. But let me just walk you through what Petco Park is doing at the baseball stadium. I think this will help paint the picture. And I'm sorry I'm belaboring this, but it's important because I believe you can leverage this to get more folks inside and do it safely. What the CDPH guidance document talks about is, how to go through the proof of vaccination. And what Petco does is basically I get on there to buy a ticket. I'm going to go ahead and register. I do an attestation saying I'm Gary Johnson. I've been fully vaccinated. Most importantly, when I get to the baseball park, I'm already going to know that I'm going to a particular entry point that is for vaccinated only or tested only people. I walk up, I'm going to pull out my vaccination card or a picture of my vaccination card or even a picture of it on my mobile device. They're going to look at that and then they're going to send me into the vaccinated section only, and I'm going to sit in my seat. I will have somebody that's not from the same household sitting right next to me, but we'll all have our face coverings still on our face. You could go through the very similar process at your church place of worship if in fact you desire to do that. Now, why do they have a tested only section? The tested only section still has to maintain the 6 feet of physical distancing, believe it or not. Why do they offer that, though, as an option? Because if I am a person that wants to go to an event and I want to purchase a ticket, but yet I want to go to a section where I think it's safer for me, but I don't want to get vaccinated or I haven't had the chance, I can go to a tested only. I have to have my test from a PCR test 3 days before the event, or I can get an antigen test, but that test result has to be back showing I'm negative 24 hours before the event. So I'm sure I've thoroughly confused you on all that, and we'll hang in there for some questions for me to clarify. But that is something I would highly encourage you all to take a look at. Read the addendum in this particular document. I'm sure the link will also be put on the chat if it's not already there. I think I have one more slide or two. Maybe I don't. That's it.
So if I may, Gary, thank you very much. And you're right, this is a lot of information to process. And you were actually also correct in referencing the Supreme Court of California. And in the question that came in, the pre-question that did come in talked about here in California, San Diego, we still must adhere to the 6 foot distancing requirement. And I'm tossing it back to you because you have a great way of massaging and really getting to the point of risk. When
Right.
a faith-based organization or another agency business just does not is aware but does not adhere, and the responsibility that comes with that.
Yeah, and I think I'm glad that you gave me an opportunity to catch my breath and recalibrate everything, because I don't want folks to rush to failure. That, hey, it was the Supreme Court, not the state Supreme Court, the federal Supreme Court that basically, allowed max capacity. Basically, that if I can have a certain capacity above 50% in another venue, then I should not be relegating a place of worship to 50%. So that's where you're at. And yes, the state lawyers have said that, hey, we still have to maintain 6 feet of separation. Folks, I expected nothing different coming from lawyers at the state to tell you that, just to make sure that it's a safe environment. So it goes right back to you all saying, make this an informed and deliberate decision. If you want to increase the capacity indoors and you want to establish a vaccination section only, it's not terribly tough to do, But it's going to be a work pill, and you need to go through the process to determine if that's what you want to do to be able to open up your indoors to a greater extent. And so that's where I'll go with that. And back over to you, Elizabeth, for any other Q&A, or we can just jump into the medical update, and then we'll go from there.
A comment from me and then two more questions. So for any of our partners who would like to submit their plan, their vision for their reopening, I mean, you've got your reopening plan, but you would still like to just run it by Gary, run it by, the team, make sure you're on the right track. Please encourage you, send it to us. We receive, this kind of request all the time, and we're more than happy to just spend time with you and shepherd you through some of this that can really seem and is complicated. So open invitation for that. Gary, a question that came in about Bible study. With the county moving, now that we're in orange tier, what are the new parameters for children's classes in Sunday school, vacation Bible school, summer camps? Is this only activities limited to outdoor spaces? Do we need to have a safe reopening plan for these activities?
Yeah, I would tell folks, up until the 16th of June, the day after, they're supposed to retire the tier system and the state's going to fully open our economy. I would tell you to stay the course, maintain your safe reopening plans, adjust them as you can, especially if you're going up in capacity. You may need more volunteers to help you kind of make sure that everybody's doing the right thing and they're not closing in on each other too much. So yes, and then when it comes to to our Sunday schools for our youth, I typically go back and reference some of the K through 12 guides because it's a classroom setting. We do know the CDC basically recommended a 3-foot separation between our youth, especially our elementary age kids, but it was a recommendation. So you're finding a lot of schools to try to get everybody back in the classroom. They don't have to basically spread their children out in the classroom to 3 feet. They can actually even go less than that. But then the same thing applies. Whenever you take an action like that, think it through, because then what can I do? Even if I'm going to close the distance in the kids, what can I do to actually do something to mitigate the fact that I'm making that change? Can I put in some plexiglass? Can I open the windows? Can I do some HEPA filters? So again, just think through what you do. And if you can mitigate on the fly to help keep it a safe environment, I would do that. When we get to 16 June, pretty much a lot of these strains are going to be basically recommendations only, not necessarily public mandates that we have to do these things. And then you can basically kind of go from there. Your camps, our church camps and things like that, the day camp guidance still is in effect, even though it's a wee bit dated. I just reviewed it recently. It still makes sense, and I still think you can operate within that. Understand that cohorting, we've talked about that before, trying to keep those kids in a little bit of a bubble so they're not overly mixing is still a great technique. It's not a mandate. Or what they call your stable groups, which are a little bit bigger than your group of 16. A stable group is something a little bit larger. But again, just understand it's another mitigation tool to try to limit the mixing of your teachers, of your pastors, and your youth and things of that nature. And it could be the same for adults when you're doing your Bible studies as well. So I don't think there's really any changes per se, with the exception of you may be starting to establish some vaccination-only sections to keep doing what you're doing until we get ourselves to 15 June.
Thank you. Thank you. More about June 15th in a few. But as you know, Gary, we received a question about singing and chanting. That really is a cornerstone for our houses of worship. Affirmations, guidance. What can you share with us, Gary?
Okay. This is a big deal, and there was some guidance that recently was released for the indoor guidance that we just showed you, the indoor seated events and performances. And so if you can imagine, that guidance was primarily designed for maybe indoor type of sporting events or indoor theatrical type events. And so you have performers, and you will see that CDPH kind of refers to our worship leaders or our worship bands as performers. In that guidance, and that guidance is now referenced, and we're supposed to look to that guidance when we want to do things like worship, singing, and chanting. it now says that that our performers can be indoors and they can actually be without face coverings to perform. They need to be, they say, and the distancing is greater than 6 feet. They don't tell you 12, they don't tell you 24, they say greater than 6. Now, with respect to the congregation or the audience, although it discourages this, it says that the audience can, it says discourage them from singing or chanting, which really means that your congregation can also worship, okay? But they must remain face covered, okay? And so that's where we're at right now. So we're back indoors now with the ability to do indoor worship service with a band or with a soloist, however you want to do it. They don't have to be masked up to sing or to blow an instrument, things of that nature. They need to be about, a little bit greater than 6 feet apart at a minimum when they're up on the stage. They need to be greater than 6 feet away from your congregation, and your congregation can now sing and chant with face coverings on. This goes back, though, to please, just, slow is smooth and smooth is fast. I would hope that folks are not going to be screaming at the top of their lungs, even with the face covering on, in a closed, location with 100 of our congregants inside. If the drummer doesn't need to sing, for example, might be a good idea to keep the drummer, with the face covering on, things of that nature. So just use really good judgment, but you have now the authority, permissibility, so to speak, to start doing our worship indoors, singing and chanting, playing instruments. And again, the guidance, where that guidance can be found, is in the CDPH indoor seated live events and performance guidance. Somebody will stick that on the chat, I'm sure, but it was one of the slides that we first talked about. Over to you, Elizabeth, because I know we're running short on time.
Yes, yes, we are. Okay, just consider these next two before we welcome in Dr. Sejong. Lightning round. Okay, for vaccination only, Gary. For vaccination only sections, do people have to actually show their vaccination card, like physical, like ID?
Yes, and I think we had a slide up there that kind of, maybe the slide that we showed, though, I don't believe it actually showed, yeah, that slide that we showed you on testing fully vaccinated sections didn't show you exactly how to go about doing the validation or the verification process, but it's what I kind of gave you as an example of what Petco Park is doing. What it says in the CDPH guidance is all you have to do is show proof of your vaccination card. Either you have it in your hand, or you have a picture of it, or you have a picture of it on your mobile device. The other thing that can suffice is if you have some kind of formal medical doctor's note that says you've been vaccinated. And so again, that guidance is in there.
Mm-hmm.
There it is. They've done it. Down there at the bottom, verification. You can see with the vaccination status, that's what they're asking you. And as I said, down at the bottom, you can see the ors, and ors. That's how you can show it. It doesn't even say that I have to hold my library card or my California driver's license next to it. There's a lot of trust that's being levied upon folks, as it maybe should be. So anyways, on the testing side, I'll just tell you for testing again, I told you about the children have to be tested if they're greater than 2 years of age. They have to show proof of a negative test. I know Petco Park is actually offering tests for children under the age of between the ages of 2 and 11 or 2 and 12, I think, on site, doing an antigen test, rapid test, if needed. So they've gone above and beyond to make sure that even the kids can get tested, because some folks don't think that the kids needed to be tested, but they actually do. That's just for testing, because we know we can't vaccinate our children younger than the age of 15 right now. Back over to you, Elizabeth.
Thank you, Gary. And if I make just one more, with many caveats, what's going to happen on June 15th?
Everybody's probably going to celebrate a wee bit. What we have out there is the memorandum. They're calling it Beyond the Blueprint. There's a memorandum that we'll put the link in the chat to as well. It's a page and a half. It doesn't put a lot of details, but it does say a couple things specifically. One is it says that on the 15th, the state is going to fully open its economy. Below that, it talks about, well, what does that mean to, all of our business sectors? And it basically indicates that all those business sectors that are outlined on that activity and tiers table that we've talked about, where that addendum is with all the vaccination verification stuff, basically places of worship, restaurants, gyms, all those sectors, it's saying that they will be allowed to return to quote unquote usual operations. The only caveat the state puts in there is they talk about there could be some limited restrictions, and I use that word limited restrictions, placed upon very large or large scale high risk events. And the only other thing that they actually physically call out in this memo is about conventions, that if a convention is 5,000 people and you have not fully proved their full vaccination, that's a cap. And that cap is going to be in place until 1 October. But folks, again, that's where we're at. So we're waiting for an updated guidance document. The state has promised us they'll give us more detail on what beyond the blueprint means. But it basically is the paradigm shift I've talked about. At the 15th was selected predominantly because at that point in time, most folks would have had a chance to get vaccinated. They made the personal decision to do it or not to do it. After that, the paradigm shift is no more public mass mandates to do certain things to protect the minority of those that were very susceptible to the virus and our frontline workers. Those are fairly well protected at this point in time. Now it's going to be the individual that has to make the decision if they're going to go to a fireworks celebration or not, because they're concerned that after the 15th of June, people will be there without face coverings, without physical distancing. It's your decision to go or not go. And if you do decide to go and you want to wear a face covering, that becomes your personal choice. That's the way I see things after the 15th. More guidance to follow. Last thing I'll say is CDPH has said, and I quote them, on the 15th, the tier system will be retired. And so what that means is that all the restrictions and strains, depending on what tier you're in, is also retired. Best I can give you right now, as soon as we get more meat on the bone from that guidance, we'll get it to everybody. So stay tuned into this venue and you'll get the updates as we get them.
Thank you, Gary. So much to share. And thank you also for your advocacy, your tremendous advocacy on our behalf up to the state. Very much appreciate you. Hang out with us if you, and just a note to everybody before I transition to you, Dr. Sayan, your questions are coming in quickly, your comments. We are capturing everything because of time. We may not be able to get to them. No worries. We will come out with responses like we did a couple of weeks ago, a frequently asked question document with responses. Dr. Sayan, if I may, welcome to our faith-based organization family.
Thank you, Elizabeth. Thanks for letting me in and glad to hang out with all of you.
Wonderful. You've got Mark. What is Mark updates?
Oh, so yeah, so this is about our monoclonal antibody regional center. So these are, and I know you usually have Dr. Tudor, she has been a leader for our region, really working with the state, with the federal government to get this resource and this unique resource into our county. And what this is, it's free medication for folks who have COVID. Remember, we're talking a lot about vaccinations and preventing COVID, but we still have people who are suffering from COVID, who get infected, who get hospitalized, and who pass away to a much lesser degree, thankfully, but we still have folks who suffer from COVID. And if you are diagnosed with COVID-19, the sooner the better you can use this outpatient therapy, then the more likely you are to be preventing yourself from being hospitalized or passing away from the disease. So please know about this, please pass the message. And we thankfully expanded and now have a site in South Region too at an old fire station. And that's a partnership with San Ysidro Health. The other one is with Palomar up north. And there are others in the community I want to acknowledge too, like Family Health Centers, who's also has this type of resource available.
Thank you. Thank you for that.
All right, Elizabeth. So yeah, I'll just spend I know we're short on time. I'm just gonna, skip the slides, just give a couple of highlights and things that are on my head, just so that you can go back. I think probably mostly for you all tuned in right now. I know I'm looking at a lot of the Q&A. You really want time with Gary. so I want to just speed up and any questions you have for me, please let me know. But I just want to say that, thank you you all are trusted messengers. Clearly, there are articles, I know this week, even I think I saw on KPBS or something, an article about really the faith-based community being a trusted voice for many individuals when it comes to vaccines previously, and hopefully continually you will also do that for the need for testing if people have symptoms of COVID-19 as well. COVID-19, while unfortunately it still continues to really ravage other parts of the world and even other parts of our country, where some parts have higher hospitalization and deaths, in those areas are hotspots. Thankfully, in places like California, Texas, there are other places that are doing much better than before. And we've gotten off that winter surge. We I'll just give you some terrible news, unfortunately, or a statistic that there was last year in 2020, when we looked at San Diego County data, COVID-19 was the third leading cause of death. Of course, it wasn't with us for the whole year. This year, so far, because of that winter surge, COVID-19 is still the leading cause of death for San Diego County when we're looking at our early data. And thankfully, and really thankfully, due to vaccines primarily, we have come down from that surge, and we are continuing to. And vaccines have this tremendous effect and ability to protect, most of us from getting infected, and even if you are infected, really significantly improve the chances that you are going to stay out of the hospital. You may have heard in the news things about breakthrough infections. Those are expected to some degree. We know these vaccines are not 100%, but those 5,800 breakthrough infections that they were aware of, even if that's an undercount, is still a tiny drop in the bucket relative to the 84 million or so Americans who've been fully vaccinated, right? So keep that in perspective, and please motivate your families and your friends and your colleagues and your congregations, etc., to please strongly consider vaccinations for their health, their community's health, and their loved ones' health. As we expanded to 16 and down to 16 years of age, a lot of young, healthy individuals are now eligible who were not eligible before, and often they wonder why they should get vaccinated. And please remind them, that this is still the safest way to get immunity against this disease. The data so far, 6 months out, is still really strong about the effectiveness of these vaccines. And so we'll see how long these vaccines are effective for. I don't see a booster coming anytime soon, despite what CEOs may want you to believe. And then please also know that, right, younger individuals are often the ones who are getting COVID at higher rates and then bringing it back to more vulnerable individuals in other settings, or older adults, for example, who are then more likely to suffer. So, for many reasons, and in addition to also that there's many variants outside, and increasingly, right, that are more transmissible, more deadly, some of them that can evade the vaccine to some degree more than others. So the more people we have vaccinated, the less opportunity the virus has to spread and even create new additional variants, right? We don't know what the future variants will look like. So we want as many people to get vaccinated now. So we are doing really well as a county. We're vaccinating the most people relative to other Southern California counties. And I think in the state, we're pretty well positioned, but that doesn't mean we need to stop or slow down. We need to get ahead as quickly as possible and continue vaccinating. We're definitely hitting up on a couple groups and areas, and whether it's age groups or parts of our county or race, ethnicity, however you slice and dice the data, there are definitely groups that are not getting vaccinated at the same rates as other groups. So if you can see this, I'll just share my slide. For this one slide, I think that is important to share right here, and it just shows just by race, ethnicity. Again, you can look at disparities across many different lenses. This is just one lens that some of you may appreciate a look through. And so this shows you the line on the bottom, and you see the percents here, and you see that, for example, amongst the African American community, 25%. 0.6% are vaccinated, are estimated to be vaccinated, versus, for example, Asian Americans are 48.2%. So there are significant disparities, of course, and we have to keep that in mind, and then double down on our efforts in certain with certain groups and making sure that everyone is as informed as possible so they can make the most, evidence-based or data-driven or emotionally driven decisions, really, especially as many of us have seen a lot of suffering from COVID. One other last example I'll leave you with is that I was listening to a story on the radio, and Kirtana, if you could put in the chat, please, really about in Israel and how they're countering some of these fake news, if you will, around vaccines, and they were really relying on for the ultra-Orthodox community, a lot of their faith leaders, and while that definitely helped, and they talked about this helping in this story, they also talked about this unfortunate event of this pregnant woman who, with 5 children dying and her fetus dying, who was before she even got the vaccine. She had an appointment scheduled, just hadn't gotten it yet. And then this person did pass away from COVID. And that story, went miles in terms of getting individuals interested in at least contemplating, right, getting that decision about getting the vaccine to protect themselves and their community. So thank you for everything you do. I'm here for questions. Thank you, Elizabeth.
Oh my goodness, thank you very much, Dr. Sayon. And there's misinformation, the reality of misinformation, about the vaccine. And one that I know I've heard and other community members have reached out to me about is, they've heard that Pfizer and other COVID-19 vaccines may impact fertility. Is there evidence behind this? What's up with that? Important.
Yeah, no, there is no evidence about fertility. So I will say that, Pfizer has trials with pregnant women right now that are ongoing. I don't know if Moderna has, but none of them were included in the trials. That said, since the trials, there's a CDC page, I just haven't checked it in a week or two, but I know there's been over 70,000 pregnant individuals who've signed up for the vaccine and identified themselves as pregnant on that vSafe app or application that many of you probably have used if you've gotten the vaccine, to do active monitoring. And they've compared the data for those people versus kind of the pregnant population in general. And there has been nothing that's been remarkable or distinct in terms of side effects or bad effects from the vaccine, meaning there hasn't been a higher rate of, miscarriages or stillbirths or anything like that. But on the contrary, for pregnant women with COVID-19, there was a meta-analysis where they looked at many different studies around pregnant women with COVID-19, and they showed that when you take all that data together and weight them separately, that the data is pretty solid that pregnant women with COVID-19 are more likely to have certain events like stillbirth. I think they had over 2-fold risks or odds ratio for stillbirths, for example. So lots to consider, but yeah, nothing around infertility.
Thank you. Thank you for that. And so I have to ask you about J&J, Johnson and Johnson,
Yes.
Janssen. What is
Sorry.
going on?
Sorry, the big thing that I forgot to talk about. Yeah, so since I know you all meet every 2 weeks, so a lot of updates in the last 2 weeks. Last week, Tuesday, big announcement. CDC, FDA came out with the announcement asking to pause use of this vaccine while they investigate a safety signal, and it was a safety signal. And this shows you proof that the system and the process is working, right? That these are the most monitored vaccines in the history of vaccines, and they got a safety signal just based on 6 cases of this rare event. And it also, in truth, there's AstraZeneca, which is not in the US, but has similar events going on or association to these blood clots. And these are blood clots that are in the brain, but also in the context of low platelets, which usually doesn't happen. So because of that, they said, hey, let's pause. Let's take a deeper dive, better understand what's going on, and see if we have to make different recommendations. Please recall that we did a similar thing a few months ago locally at Petco Park when we had a cluster of adverse effects coming after a certain batch or a lot of vaccines. So we paused, the state paused, the rest of the country continued to use that, but we investigated with the CDC, FDA, the manufacturer, the state, and we determined it was okay to continue. So last Wednesday or Thursday, I forgot, the CDC met on the 14th, and they did decide, hey, that recommendation body or advisory body, they said, let's continue that pause just for another little while. So just in case there are new cases that continue to come in, and so we could better understand if there's any themes. They couldn't identify any themes other than they were all females 18 to 48, but they couldn't identify any other themes, like not everyone was using birth control or something like, I don't know, but the so there, I heard that there were a couple of additional, just a few additional cases reported, but in general they are meeting Friday, and so I know Dr. Fauci has said, and that probably they will continue to use Johnson & Johnson to some degree. Maybe it's going to be age cutoff, 50 and over. Maybe it's going to be for everyone, but just with more caution in certain age group, and especially more with females than males. And so, and the other thing is that providers are much more aware of that the treatment for this condition is a little different than the usual blood clots. So more to come. Friday will be a big day for the news, but this is a key tool, and thankfully we do have 2 other alternatives in the US, but this is a key tool as well in terms of our types of vaccination, because Johnson & Johnson is just much more stable. You can use it in especially a lot of our mobile events and homebound and other kind of efforts like that.
Well, thank you. And as you know, as everybody, our learning community knows, as we receive updates, we will send them out to you, via our e-blasts. And so Friday will be a big day.
Yes.
Friday will absolutely be a big day in terms of Johnson & Johnson, and just overall, check in as to how we are doing with our vaccination efforts here in San Diego County. Okay. Questions are coming in. We will be responding to them offline and via, a document we will synthesize later on afterwards and send it to you. Thank you, Gary, for everything that you do for us and for keeping us on point, which what really matters around reopening, and for your patience and grace around the nuances, and A before E's except after C's, that matters so much to all of us. Dr. Sayon, you are seamless, in everything that you do. So thank you for jumping in and helping us this afternoon for another day, everybody. I have
My pleasure.
a Mark success story to share with you. My family was saved because of Mark. So for another day, I will share that, encourage everybody to please, who is eligible, explore that. And in the 2 minutes that we have left, I did, thank you, everybody, ending our time together, how we began with a thank you. Thank you for joining us and spending time with us this afternoon. We are, Ramadan, the holy month of Ramadan is upon us, ending May 12th, with the holiest day being this coming Sunday, May 9th. To our Muslim brothers and sisters, we say Ramadan Mubarak, and blessings to you and blessings to everybody. Thank you. Let us stay connected, and to be continued. Gary, Sayon, the team, we name names, Zach, Maya, Kirthana, Allison, Vivian, Sophia, Alexis, you make me look good. And some days, I need lots of help. So thank you. Thank you for allowing me to be part of your village. And thank you, everybody. You be safe and God bless. Bye-bye.
Bye.
God bless.